Thank you for inviting me in annual Korea American Spine Society. My name is Jinsu Song. I'm an ID specialist, and I'm currently working at Division of Risk Assessment and International Cooperation at the Korean CDC. So today I'm going to talk about the effect of COVID-19 from South Korea's perspective, after briefly touching upon the current situation and Korea's response to COVID-19. So please understand that I'm virtually ignorant of spine surgery. So most of what I'm going to talk about comes from medical and public health perspective. So major pillars of public health response for COVID-19 in Korea is not so different from those in other countries. So we're focusing on traditional public health measures such as early case identification, isolation of cases, contact tracing, and quarantines of contact. So Korea has quickly expanded diagnostic tests early in the epidemic, immediately after obtaining genetic material from Wuhan, China. So for efficient and safe specimen collection, we introduced screening stations such as drive-through or walk-in screening centers in multiple cities. So this slide shows the timeline, the progress of the situation and how our government responded to COVID-19 until early May. So after a cluster of cases of unknown pneumonia was first reported, Korea CDC and our government issued alert level 1 and began to prepare for possible importation of COVID-19. The alert level increased to level 2 yellow color as the first case was confirmed, and then to level 3 orange, and then to highest level 4, which is in response to large cluster linked to a religious sect called Shincheonji at Daegu and Gyeongbuk province. Oops. So, now, more recently, we have had difficulty in dealing with and suppressing small and medium-sized outbreaks derived from multiple community outbreaks and imported cases from abroad. So as of June 29, the total number of confirmed cases is 12,757, of which almost 90% was released from isolation. So at the moment, average daily confirmed cases are somewhere between 30 to 50. So since COVID-19 outbreak can occur in any confined, crowded, and close contact environment, KCDC advises postponing or switching to non-face-to-face method in all social gatherings. Talking about earlier success of responding to COVID-19 in Korea, here are some factors that many experts mention. So with basic principle of epidemiologic investigation, such as test, trace, and treat, our government adopted mass testing for early detection. So instead of very restrictive measures or total lockdown, our policy of extensive tracing was adopted. So, and moreover, to avoid the health system crisis due to overloaded hospitalized patients, community treatment centers are set up to accommodate mild or asymptomatic cases, which enables effective resource allocation. And again, and in addition, thanks to universal health coverage in South Korea, all patients have basically access to free treatment covered by Korean National Health Insurance Scheme. So financial burden of treatment is minimized for almost all patients. Lastly, a painful experience of MERS outbreak in 2015 has led to lessons learned and a quick response from both public and government. So public is also prepared to accept the extensive contact tracing for effective detection at the expense of privacy. Now, let's switch gears and talk about the effect of COVID-19 on some infectious diseases. The first of all, when you look at the this graph on the left side, you will note.
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.